Welcome to this short review of type 2 hypersensitivity, the antibody-mediated reaction where antibodies target cells or tissue-bound antigens. Hi, I'm Christopher, and in this video we'll talk about why type 2 reactions can feel so clinically scary. The immune system may use normal defense tools but point them at the wrong target, their own body. Type 2 hypersensitivity can be scary because the immune system's weapons are directed at cell surface or tissue-bound antigens. Sometimes that target is an intrinsic antigen, meaning that it is a normal self-antigen that belongs to the patient's own cells or tissues. In immune-mediated hemolytic anemia, or IMHA, antibodies bind targets associated with red blood cells. The immune system then treats those red blood cells as if they are dangerous, leading to destruction through mechanisms such as complement activation or phagocytosis. In immune-mediated thrombocytopenia, or IMTP, the target is platelets. When IMHA and IMTP occur together, we call that Evans syndrome. So the terrifying part is not that the immune system has stopped working. The terrifying part is that it's working against the patient. Later, we'll ask why self-targeting begins in the first place. But for now, the key type 2 pattern is this. Antibody binds a cell surface or tissue-bound target. Type 2 hypersensitivity can also involve extrinsic antigens. One way this can happen is through a hapten. A hapten is a small molecule that is not strongly immunogenic by itself, but can become immunologically important when it binds to a larger host molecule, such as a protein on a cell surface. For example, some drugs can bind to red blood cell surfaces and make new antigenic targets. The antibody response is not simply to the drug alone, and it is not necessarily against the unmodified red blood cell alone. Instead, the immune system recognizes the new drug-cell surface complex. If antibodies bind to the new surface target, the red blood cell may be destroyed as long as the drug or modified target remains present. One visual caveat. In this schematic, the antibody should be thought of as binding the new antigenic site created by the drug-cell interface, not just by the drug shape itself. There are several clinically important type 2 hypersensitivity patterns. Some involve the destruction of blood cells, such as IMHA, IMTP, transfusion reactions, and neonatal isoerythrolysis. Others can involve antibody binding to tissue-bound targets or receptors, where the result may be tissue injury or altered cell function. The common thread is this. Antibody is binding a target fixed on a cell surface or tissue. That is a key difference from type 3, where antibody binds soluble antigen and immune complexes deposit in tissue. A common clinical trap is to blame IMHA or IMTP on a recent vaccine exposure. That history matters, we should record it, but timing alone does not prove causation. The 2019 ACVIM consensus statement on canine IMHA notes that causal data linking vaccine and IMHA are lacking. So a recent vaccine may be part of the history, but it should not end the diagnostic search. IMHA may be primary, or it may be associated with other triggers, including infectious agents, medications, inflammatory disease, envenomation or sting reactions, or systemic disease. A few of the causal infectious agents include Ehrlichia, Anaplasma, Babesia, Leptospirosis, hookworms, and whipworms. Neoplasia, or cancer, has also been identified as a potential cause. Thus, if we simply say, it was probably the vaccine, we may be missing an infection, parasite, drug exposure, inflammatory focus, or other clinically important trigger. A better approach is to say that correlation is a clue, not proof. A temporal association should sharpen our history taking, not shut down our workup. To summarize, type 2 hypersensitivity is antibody mediated. The antibody target is usually a cell surface or tissue-bound antigen. The target may be intrinsic, meaning part of the patient's own cell or tissue, or extrinsic, such as a drug-associated hapten on a cell surface. Injury can occur through complement activation, opsonization, and phagocytosis, or altered cell function. Common veterinary examples include IMHA, IMTP, and transfusion reactions. And clinically, remember the causation lesson. A recent vaccine may be part of the history, but correlation does not prove causation. Keep looking for those other triggers. Thanks for watching. I'm Christopher. What you understand today helps protect your patients tomorrow. And I'll see you in the next video.